Lunsumio contains the active substance mosunetuzumab, which is a type of antibody. This is cancer medicine. It is used to treat adults who have a blood cancer called follicular lymphoma. In follicular lymphoma, a type of red blood cells called B cells become cancerous. The abnormal B cells don't work properly and grow too quickly, crowding out the normal B cells in the bone marrow and lymph nodes that helps to protect you from infection. Lunsumio is given to patients who have tried at least to previous treatment for follicular lymphoma, when either the cancer has not responded to them or it has come back again. Indications. Lunsumio as monotherapy is indicated for the treatment of adult patients with relapsed or refractory follicular lymphoma who have received at least 2 prior systemic therapies. How to use. Lunsumio is given under the supervision of a doctor experienced in giving such treatments. Follow the treatment schedule explained to you by a doctor. Check with your doctor if you are not sure. It is given intravenous as a drip infusion. It is given over 4 hours during the first cycle. Each cycle is 21 days, and in the first cycle you will be given the 4 hours infusion on day 1, day 8, and day 15. If side effects are not too severe, the dose may be given over 2 hours during the following cycles. You might be given other medicines 30 to 60 minutes before you are given Lunsumio. This is to help prevent infusion reactions and fever. These other medicines may include corticosteroids such as dexamethasone or methylprednisolone, paracetamol, and antihistamines such as diphenhydramine. Lunsumio is normally given in cycles of 21 days. The recommended treatment duration is at least 8 treatment cycles. However, depending on side effects and how the disease responds to treatment, you may be given up to 17 cycles. In cycle 1, you will be given 3 doses of Lunsumio in the 21 days. Day 1, 1 mg. Day 8, 2 mg. Day 15, 60 mg. In cycle 2, you will be given just 1 dose. Day 1, 60 mg. In cycles 3 to 17, you will be given just 1 dose. Day 1, 30 mg. Contraindications. You must not be given Lunsumio if you are allergic to mosunetuzumab or any of the other ingredients of this medicine. If you are not sure, talk to a doctor or nurse before you are given Lunsumio. Talk to a doctor or nurse before you are given Lunsumio if any of the following apply to you or you are not sure. You have ever had heart, lung, or kidney problems. You have an infection or have had an infection in the past which lasted a long time or keeps coming back. You are due to have a vaccine or you know you may need to have one in the near future. Precautions. Before using mosunetuzumab, tell doctor pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor pharmacist a medical history, especially of past, current, recent infection, including Epstein-Barr virus. Side effects. Tiredness, dizziness, diarrhea, nausea, muscle joint pain or headache may occur. If any of these effects last or get worse, tell doctor pharmacist promptly. Tell doctor right away if you have any serious side effects, including easy breathing, bleeding, mental mood changes such as confusion, trouble understanding things, forgetting who or where you are, trouble speaking, reading or writing, numbness, tingling of arms, legs, drowsiness or trouble sleeping, insomnia, loss of balance, or trouble walking. People taking this medication may have worsening of their symptoms, tumor flare. Tell doctor right away if you have symptoms of tumor flare such as tendon or swollen lymph nodes, chest pain, cough, trouble breathing, or pain or swelling at the site of the tumor.